Cognitive behavioral therapy is one of the proven treatments for weight management. Weight expert Dr. Sandy Van joins us to talk about how to apply this important tool on our weight management journey. Diabetes Primetime is brought to you by Relion Community, an amazing program available exclusively for Walmart customers with a Relion Premier meter. Get free diabetes tips, recipes, and support sent right to your phone. Just click the link in the comments to learn more. Before we get started, let me know in the comments where you're watching from and tell us if it's your first time joining us. Dr. Van, thank you so much for being here with us.
Thanks for having me.
Let's start with a quick definition. What is cognitive behavioral therapy, or CBT?
CBT is a form of psychotherapy that was originally designed for mood disorders like depression and anxiety, and it's based on the premise that your thoughts are directly linked to your behavior and your emotions, and that by changing the way you think, you could change your behavior and you could change your emotions. And so it sounds a lot easier than it is to do, but the idea of CBT for weight management is to really capture unhelpful thoughts that generate unhelpful behavior in the context of eating or exercise or self-care strategies. So the idea is that you identify distortions. Distortions are thoughts that are rooted in inaccuracy, and you replace them with rational thoughts that hopefully elicit helpful behavior, such as eating well or engaging in more activity or engaging in more self-care strategies.
So we know that there are proven medical treatments for obesity. How can CBT be used in conjunction with these treatments to help them be more effective?
Well, I think that there's a really nice synergy that happens between pharmacotherapy or anti-obesity medications and the use of CBT. Sometimes it's really, really difficult to engage in CBT when somebody's appetite is really, really strong. And the thing about appetite dysregulation is that there's this really strong biological underpinning. Not everybody has the same level of hunger hormone or fullness hormones. Some people have real difficulty in maintaining structured eating behavior or staying within a certain calorie intake because their appetite is so strong. So being put on a medication really helps open the door to using your cognitive bandwidth for self-regulating food choices and activity and self-care strategies. These are things that are enabled more easily with medications on board. I'll often explain to patients that medication isn't going to be the cure for their problems or to their lifestyle. It is something that helps level the playing field. It helps somebody leverage the use of the lifestyle modifications they know that they want to engage in because they're less busy in their mind with thoughts about food and preoccupation and cravings and hunger.
So it's almost like the medications lower the volume on the food noise related chatter and really enable us to use tools like CBT and help them be more effective.
Yes, medications will create more space and cognitive bandwidth for that person to just engage in lifestyle behaviors that are really important to them.
We're going to pause here and do our trivia question. If you answer this question, folks, you'll get a helpful guide for managing negative thoughts. These are practical tips to shift your thinking and stay grounded when negative thoughts arise, and you'll get it for free if you answer our trivia question, which is, true or false, mindful eating can help us become more aware of our hunger and fullness cues. Is that true or false? Can mindful eating help us become more aware of our hunger and fullness cues? Put your best guess in the comments and you'll get that guide delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So Dr. Van, we've talked about how medications can help make CBT more effective. I'm curious to hear your thoughts on whether doing CBT can help people on medications.
Oh, yes. Somebody who is on medication can lose weight passively on medication by engaging in similar lifestyle behaviors that they were in prior to starting treatment, but consuming less of the high calorie foods, for instance. They can lose weight with medication doing that. But what I find is that the use of cognitive behavioral therapy can really help optimize weight management outcomes. And it's in ways that you wouldn't necessarily think. Cognitive behavioral therapy can help one develop that skill of restraint and self-regulation around food. So for instance, nighttime eating is a really common one. How does that person approach the high risk setting of wanting in the evening? Can they think differently about that setting to exhibit more restraint and practice that skill by changing the way they think in those situations and really observing the aftermath of those episodes so that they continue to do it? So there's that. Other predictable barriers when it comes to weight loss medications and people's experience on them is their expectations. A lot of patients of mine will have expectations that far exceed what medications are capable of offering. For instance, I have patients who might describe they are looking for a 40% weight loss. And 40% is considerable weight loss that you can see with bariatric surgery. And some might actually see with medication, but not many. And so it's about also addressing the reasoning behind that arbitrary weight loss target and helping them understand that the discrepancy that they have between their current weight and that expected weight might be a magnitude of distress that correlates to the expectation that they have. So helping them reframe their expectations and coming to a place of self-acceptance of where they're at, not in a way to prevent them from engaging in change, but to really open themselves up to the idea that they're good as they are. And when that happens, you're flourishing because your inner experience is positive and you're more likely to engage in thoughts that are more helpful in those settings.
Oh, I love that. So what I hear you saying is that we can use CBT to kind of accept wherever our best weight settles out when we're on medications or whatever our weight management treatment plan looks like.
Yes. And part of CBT, one of the core tenets is mindfulness of your thoughts in the moment, mindfulness of the present moment. And a lot of the distress that arises in somebody's lived experience with weight is wanting to be somewhere they're not. And this is maybe born out of experiences that they've had when they were younger. If somebody was bullied or stigmatized, it comes from our cultural messaging around weight and weight stigma. And so the lens in which they view their experience is often influenced by what they've experienced, what they see, and then what they want to be and what they normalize in their mind. And so really anchoring themselves to the present moment and accepting and being compassionate about their experience can really just help them drop the struggle with those negative thoughts. It's a lot easier to turn down the volume on something when you've accepted that you're good as you are. It's hard to actually have negative thoughts when you truly believe that you are perfect as is.
I love the way you phrase that because I think many of us don't want to be where we are. What modalities have you seen to be helpful with that?
There's a modality that was actually born out of cognitive behavioral therapy. It is considered third wave CBT, but it has its own name. It's called acceptance-based commitment therapy. And it's a form of psychotherapy that's also gaining ground in being empirically supported for weight management. And the idea behind acceptance-based commitment therapy is that we are often trying to change our inner experience, meaning if we have negative thoughts or if we have negative feelings, that we engage in something called experiential avoidance, meaning we're trying to avoid this inner experience. But in doing that, we're trying to engage in maladaptive coping strategies that then suppress that experience, that suppress that thought, suppress those negative feelings, that negative craving. And the idea of ACT is to drop the struggle. It's to radically accept that this inner experience you're having is completely normal and that you can experience it while still committing to actions that are really important to you and congruent with your values.
I'm really getting a sense as you talk about CBT and ACT, how they can be helpful on the weight management journey, because truthfully, the idea of best weight is that we don't get to decide what the number on the scale is when we're living a healthy lifestyle. So it sounds like both of those modalities could be helpful in kind of accepting where we are.
I really love using both CBT and ACT interchangeably. I don't think that one is superior to the other, and I think that everybody's different in how they respond to them. So cognitive behavioral therapy is really useful when there are very obvious cognitive distortions that person is experiencing. If you are having a distortion, it means that you are able to identify that there's parts of that thinking that are not factual. For instance, the thought that is deeply rooted in internalized weight bias, I'm fat and I'm bad. I did this to myself. I'm a failure. This is shameful. How could I overeat? Those are thoughts that are rooted in significant distortion because they're not helpful, and two, there's no evidence to actually support any of those things. How many times has somebody told you that you are bad because you are fat? How many times have you told yourself that though? How many times have you believed it because you heard it so many times? And that's another distortion called emotional reasoning, that when you believe something so deeply only because you felt it so deeply. Distortions are things that are worth challenging, but when people are experiencing thoughts that lead to unhelpful behavior that are actually rooted in rationale and, for instance, grief, when they go through a really difficult experience, and food in that moment might actually make them feel good, reasonably so. And when they think that that would be considered a self-care strategy for them in that moment. I think that ACT can be helpful in those scenarios because there's nothing that you have to challenge there because there's nothing to challenge. But part of it is being willing to accept that those thoughts are there, that your emotions are valid, and that you don't necessarily need to engage in the soothing strategy, in part because you can diffuse from those things. Part of our distress comes from being fused to every thought that we have, every emotion that we have, and letting those thoughts and emotions and that inner experience jerk us around and rope us in, but move us away ultimately towards or away from the type of lifestyle that we want. So the idea is let that inner experience be, let those thoughts be, let those emotions be, but commit to an action that's actually in alignment with your values.
So what I hear you saying is if I'm at home at night, it's after dinner, I'm feeling a lot of deep sadness. I might turn to food to kind of push that experience away. But with ACT or CBT, you're able to kind of help me stay and accept that feeling as it is, that it doesn't say anything about me as a person, so that I might be able to choose a different coping strategy than food.
Yes. And you'll see there were two things that happened there. You described the inner experience of wanting, which is a completely normal human experience. We are designed to want food. We're designed to want food, especially when it's pleasurable. But you also described another experience which was a construct of the mind, which was, what's wrong with me? Why do I want this right now? And so you can see how being fused to the wanting and fusion to the thought and wanting to change and manipulate those experiences can actually lead to a very unhelpful pattern of behavior. Because one, you're getting distressed, you're causing your own distress in that moment. And two, you're positively reinforcing a behavior that you've been trying to change, but your brain is also learning that and becoming conditioned to make that association, nighttime, post-dinner, wanting to eat something tasty. So I think that ACT in that scenario can be very helpful, but CBT similarly can be helpful. It depends on whether somebody wants to negotiate using CBT or whether somebody would rather just drop the struggle and surf the urge, which is a technique in ACT that we use.
So tell me about surfing the urge. That sounds like it could be a helpful strategy.
Yeah, surfing the urge, or what they call urge surfing, is being mindful of the inner experience of wanting in that moment. This is in the context of weight management, so we'll talk about eating. Being able to notice the wanting, notice the thoughts that come up, that bubble to the surface, and really noticing any physical discomfort you might be getting and rating it from the beginning. Maybe it's a 10 out of 10 right now. Maybe it starts dissipating and becomes an 8 out of 10. And that's what is so nice about ACT, is that you are just becoming more skilled at becoming an observer of your own experience while trying to reclaim the power over your personal choice in that moment.
So let's talk about some of the internal bias that many people with obesity experience. How can CBT help us overcome some of the societal conditioning about living in a larger body?
There are so many different scenarios where internalized weight bias will show up in one's life, and CBT can be helpful at helping one identify when they're most susceptible to what we call self-critical thinking. That is one of two major cognitive distortions in CBT that we help patients identify. The first one was permission thinking for food, but self-critical thinking is arguably a lot more pervasive because when I speak to patients, they often describe feeling shame throughout the day. They feel shame the moment they wake up, when they get dressed, when they look at themselves in the mirror before the shower, when they go to work and they're sitting at their desk, if somebody stares at them funny, it's a deeply pervasive sort of experience to have internalized weight bias. And the scary part is that a lot of my patients don't even recognize that it's there. They have completely normalized this self-critical thinking. CBT can be helpful at helping patients understand that their self-critical thinking in those moments is the driver of negative emotions in those moments. And those negative emotions will take up unnecessary mental real estate that could be going towards something that's actually helpful for them. A common example would be somebody looking at an old photo of themselves. Oh man, I thought I was fat back then, but look at me. I was so thin, and look at me now. I'm really fat. I'm disgusting. Somebody could have thoughts that they would never dare articulate to somebody else, but they live with inside. And so cognitive behavioral therapy would have them look at that thought, ask them where the evidence was to support that that thought was true. And a lot of patients will be so inflexible because they've heard that thought so many times that they won't even be able to challenge it. They'll just say, but it is, it's true. I am fat and I wasn't fat back then. But you could also ask the question, is this thought actually helpful for you? When has this thought actually supported you towards the life that you actually wanted to live, or supported your eating behavior and lifestyle the way you wanted? When has anybody ever commented on your weight like you just did? Is there any evidence to actually support the opposite, right? That you should hate your body because of the way it looks? Are there any other aspects of your body that you can appreciate beyond its shape and body size that you inherited from your parents? And so you can see how there are many questions that you can ask to really probe that initial self-critical thought. Sometimes we call it the hot thought because it's the one that generates the emotion. And to land at a thought that is a bit more rational, is a bit more fact-based, and is a lot more helpful. You might not necessarily get rid of that shame you feel in that moment, but you can definitely turn down the intensity of it and move on a lot easier.
So I'm curious whether you hear from patients, because I personally have experienced, like, if I let go of a judgment of myself, I will never be motivated to change. Do you hear that from your patients, and how do you help them rework that thinking?
Yes, I hear that all the time. And my patients are always so perplexed when I'm meant to be their obesity physician asking about their negative thoughts about themselves. They actually wish that I would agree with them, but I'm not playing that game. So when it comes to negative thinking causing motivation, there's no evidence in the literature to support that shame and blame will help one flourish with their behavior changes. In fact, the opposite is true. ACT, acceptance-based commitment therapy, evidence has shown that when one is able to move through behavior change with self-compassion, radical acceptance of themselves, and self-love, dare I say, that they are more likely to be able to sustain those changes long term.
So it sounds like not only are negative thoughts not helpful on the weight management journey, they are actually a hindrance on the weight management journey. They are keeping us from being able to do the things we want to do.
Internalized weight bias has been studied to lead to higher body weight and disordered eating behavior.
So a lot of us struggle with all or nothing thinking as it relates to weight management. How have you seen CBT help people embrace a more flexible approach?
All or nothing thinking is likely the most common distortion I come across in practice. And I don't even have to mention it to patients. They often already know that they are all or nothing. And they will sometimes say this with pride, that when I'm all in, I'm all in. But then I have to probe them about what happens when they're all out, or what happens when they're a little bit imperfect about something. And so I think that CBT is really helpful for this because when you have this all or nothing approach, it often means that when you encounter a setback, that setback will elicit this very negative thought process, this negative emotion that is likely going to have that person think negatively about their capacity to succeed further. And then what happens? They discontinue that behavior altogether. A good example is the gym, exercise. I often have patients who will describe a strong commitment to engaging in high levels of activity for much of the week in ways that I can never imagine even wanting to do myself or being able to ever sustain. No normal person would be able to commit to that. But the question is, what's going to happen when you skip the day? And when you skip a day, what thoughts will come up for you? When you skip a day, what emotions will come up for you? And what will be the behavior that you want when that happens? Because let's work backwards. So when you are experiencing a setback, what is the behavior you actually want to resume? And what is it that you want to move away from? So that is the term for that is really relapse prevention. It's not so much avoiding the relapse, it's about actually managing the relapse when it occurs and normalizing the setback, so that patients or individuals understand that setbacks are par for the course and that it's less about black and white thinking. It's more about, how do you live in the gray? How do you live in the middle zone in a way that it's sustainable for you, and acknowledge that setbacks are normal?
Because life is the gray zone, right? There's always going to be days when you oversleep or you can't get to the gym. So what we do from there is what matters.
Exactly. Life is really living in the gray zone. And part of the difficulty of accepting that is when you assume or are fused to this idea that it needs to be one specific way, that your lifestyle needs to be one specific way. But we are not robots. We are not computed to do that. And life is dynamic. So we need to leave some wiggle room for grace and changes, and modulate our behavior accordingly.
So how do you encourage your patients to look at those situations where things didn't necessarily go the way they wanted as opportunities for learning rather than a big failure?
I always tell patients, never let a setback go unstudied. I think that setbacks are so important for learning. And when people come to me, they often want to come only when they feel like they're doing well. They rarely ever want to come when they're not doing well, but that's actually the most important time for me to see them. So when patients are coming to me with a setback, I'll often ask them if it's okay that we mine the setback for data. Because what better data is there than to have a recent experience where things didn't go as planned? And I'll usually start with, what sort of thoughts came up in that moment? What sort of feelings were generated from those thoughts? I'm always trying to remind them that their emotions are generated from their interpretation of that event or their thinking of that event. And for one single event, there are millions of ways that you could actually interpret one event. So we're just really trying to land on the interpretation or the thought processes that'll actually help you stay on track. That is the overarching objective. And so we'll do this with intentionality and not make it be an experience about how bad that person was. We often need it to be empowering, and we need to use that data to move forward with more information so that when that obstacle arises again, we'll have better information. And even then, it might not be managed perfectly, but we'll have more and more to finesse that behavior with.
Well, it's funny, as you were speaking, I was thinking about, okay, you've had a day that doesn't go the way you want. You made some choices you're not thrilled about, but it's a leap from there to, I'm a bad person because those are the choices I made. And so what I hear you saying is you're really kind of defusing that leap while figuring out, when I'm faced with the same scenario, how can I make better choices?
Yes. And in the cases where somebody has a disproportionately negative reaction to one single event, I think that that's an opportunity to mine for internalized weight bias. What is it that strikes that nerve so deeply? And when have you had an experience thinking in this way and feeling this intensely about an experience? Because this can't be the first time. I think that those questions are really helpful at helping somebody understand what shapes their reactions to things and to develop more helpful responses. Because once you notice that happen again, for instance, if I hear a patient tell me, that was really stupid of me, I can't believe I did it, I will ask them to consider starting with, I'm noticing that I say I'm stupid and I can't believe I did that. Do you see what that does? It really disarms somebody. So that mindfulness trick of capturing your thinking, the thinking that comes before that emotion can be so powerful for individuals.
It's almost like you're creating a little distance. You're creating some mindfulness so that someone can have a little distance from those thoughts and recognize those are just thoughts. I have blinders on that say this is reality, and you're kind of opening up those blinders and helping them recognize all the different interpretations of an event.
Yeah, and you know what that does? The beautiful thing is when somebody becomes really curious about it. Curious is a good thing. Once you start becoming curious about the origin of these thoughts, the origin of certain beliefs you might have that shape these thoughts, it really opens one up to changing. But the opposite of curiosity is judgment. Curiosity and judgment are like oil and water. They can't be in the same room together. And so I often find that people with strong internalized weight bias have a lot of judgment, and their language that they use on themselves is really punitive. And that's worth addressing. It's often really difficult for one to address because it's an uncomfortable conversation about the inner thoughts they actually have, and they're often really visceral. And so when I hear patients speaking really punitively, I ask them to consider, what would it be like for you to put on your curiosity hat? When you have these thoughts, maintain some distance with the line, I'm noticing that I'm having this thought, and to go in with radical curiosity about what the origins of that thought are, because it then helps you start to challenge that thinking in a way.
In case you're just joining us, we're here with weight expert Dr. Sandy Van talking about the role of CBT on the weight management journey. And we're giving away a guide to managing negative thoughts if you answer our trivia question, which is, true or false, mindful eating can help us become more aware of our hunger and fullness cues. Is that true or false? Put your best guess in the comments and you will get that guide delivered to your Facebook Messenger inbox for free. So Dr. Van, we know that staying motivated with healthy behaviors is tough. How have you seen CBT be helpful in keeping people on track?
CBT can be helpful for keeping people on track because one of the core tenets of CBT is self-monitoring. And I always like to say that knowledge is never enough. You can never just read enough and listen enough to a podcast or listen enough to your doctor to elicit any change. Knowledge plus action is what's going to elicit change. So the actions that are taken in between sessions for my patients are typically experiential exercises where they track their dietary intake, they track their thinking, they track emotions that line up with that thinking, and they can also track behaviors. I have patients who will also do habit trackers and check off every time they're engaging in a habit for that week. And that in itself can be really positively reinforcing. And it also all acts as data. You're meant to do these things without judgment, without expectation. It's really just to help somebody learn their patterns of behavior, patterns of eating, and to engage that self-awareness muscle so that when they know they're tracking, they're going to be a lot more likely to be intentional with what they engage in and what they do.
So I've heard you talk in the past about progress over perfection, and I love that term. Tell me what you mean by that.
Progress over perfection is really about accepting and kind of enjoying the journey for what it is, because it's really all we have. The present moment is what we have. The next day is never guaranteed for anybody. But I think that it's such an important concept, because if we think about the direction that we're moving and we're moving in the right direction, then it means that we can be positively reinforced as part of the process of progress. If we're only reinforced when we've reached a certain target, then it means that we are waiting for something that we may not have very much control over, i.e. weight. Weight is a target that often moves. It's a moving target. Once somebody reaches it, oftentimes I'm hearing, okay, let's move the goalpost a little bit more. And so if that person's acceptance of themselves is reliant on a moving target, then we're in trouble. And this is why I invite patients to consider accepting themselves where they're at, accepting the progress, and being able to reinforce that progress along the way so that they continue to fill themselves up with positivity, motivation, and that intrinsic desire to continue to move forward, regardless of whether they reach a target or not.
Dr. Van, thank you so much for joining us tonight. This has been such an informative conversation.
It's been fun. I'd be happy to come back.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, mindful eating can help us become more aware of our hunger and fullness cues? The answer is true. If you didn't get to answer the trivia question, but you'd still like that guide to managing negative thoughts, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.